All right, so we're back. So now again, we're going to go through this page in great detail. We talked about an insulin cocktail. I really want you to have written all of that insulin cocktail information in this little square. Remember what I said, keep everything on the handout. So now look, here we go. You have your hyperkalemia. You have your muscle twitching, weakness, and flaccid. You have to know that word flaccid. I need you to highlight it. Here's what it means. It just means you're like laid out with no muscle tone at all. It's exactly what I usually see if we're going through a spinal shock. We're not, but that's what that word means also with neurogenic or spinal shock. Spinal cord injury, you know, just no tone at all. So they're flaccid. That's why those arms look like that. Underneath here, I want you to put brisk DTRs. I want you to write that because that is part of it too. If you'll remember, I said when we started this that electrolytes always mean muscle weakness and maybe seizures. Well, look, you could write the word muscle weakness on top of that to remind yourself that's part of the deal. Where it says irritability and anxiety, I need you to put the word paresthesia because you can have numbness and tingling, okay? Then the no BP, you know what I'm going to tell you. Look at the urinal. What does it remind you of? My rhyme. No BP, no PP. No BP, no PP. Y'all got it? Get it? Okay, back. See, I can't stop dancing. So no BP, no PP, okay? Because here's what I'm saying. Potassium will kill the kidneys. That's basically it, okay? Oh, you know this. This patient's EKG is showing tall peak T waves. How will you remember that? Think of a mountain with a tall, high peak. Think of a potassium that is also high. You cannot miss this. That's where the whole calcium gluconate came in. So you should be writing inside of there, calcium gluconate PRN. Here you see the dysrhythmias. Again, calcium gluconate PRN. Abdominal cramping. Remember I said potassium controls all your muscles? Well, that's called peristalsis. If you have a really high potassium, the peristalsis, the movement in the gut is going to be too cray-cray and it's going to give you diarrhea and cramping because diarrhea, you know, you feel terrible when that happens. So this is all related to the high K. It's just really, really important that you know that. Now, let me see who's staying with your girl. If you have diarrhea, what are those bowel sounds? I can't hear you. Holler back at your girl. Where you at? Euclid? Oh, okay. You over there, Mayfield? Oh, okay. Columbus, where you at? It's called hyperactive bowel sounds. I hope you're answering me. Don't just be at the house looking at me like I'm fucking crazy. You need to answer me.
Answer her.
Answer me. All right, so that's the deal, okay? Now, when we look at this page, it gives you everything that you need, except I want you to write some conditions that actually have a really high K and the opposite, a low sodium. I want you to write on the bottom of this page, maybe over here since you used this up, write SIADH and write Addison's. I want you to remember that this insulin cocktail, after you wrote it, and again, you should have wrote hydration, IV push insulin, IV push D50W, loop diuretics, K-exalate, dialysis, low potassium, blah, blah, blah. If you wrote all that like you should have also wrote something that you need to know. So the insulin cocktail activates the sodium and potassium pump. That's the purpose of the insulin. But even though you're doing it on purpose, when you give the insulin to lower the potassium, you would kill the patient if you didn't give the sugar at the same time. It's not like this patient is a diabetic with DKA. They could be, but I doubt it because, you know, you would do things a little bit different. But with the high potassium, just in general, you have to remember you give insulin with sugar. If you had a DKA, it wouldn't make any sense to give insulin with sugar. So this is specifically for a patient with a high K. Now, the last thing, I have a really good rule I think you will like. Here we go. Whenever your electrolytes are low, generally it requires, and I would come all the way in, it requires electrolyte replacement, hold the diuretics, consider EKG and monitor for paralytic ileus, which means no peristalsis. It's basically a bowel obstruction, hypoactive bowel sounds. Whenever your electrolytes are high, it basically means IV fluid bolus, antidote, which if it was magnesium and it was too high, it would be calcium gluconate. Diuretics, because diuretics generally will get rid of electrolytes. Consider dialysis. These are some really good general rules to follow. Okay? Now next we're going to do sodium. So go get lunch. I'll be back.